What we should be doing is making sure that they can physically get around their home, that they can wash their butt, that they can get in and out of the shower, that they can do all of those things, and then get them off to outpatient therapy where they can work in the parallel bars with a physical therapist who's examining their gait, where they're on a treadmill, where they're working on these things. They have the opportunity to do that. It's a lot cheaper as a community to pay for transportation to get somebody to outpatient therapy than it is to pay for them to go to assisted living or get them on Medicaid and absorb that cost. We have to really start looking and making hard decisions on exactly how we're going to handle this. If we're going to double the number of seniors that are in our community in the next 15 years, something has to change. And that's the reason why I started my company. There's a big gap there. My company is licensed and insured in this state to go in with a doctor's order to make a recommendation for a shower chair, tell the patient where to get that shower chair. That's it. And then we leave. And then what happens next? They get the shower chair, okay? They can get it from Amazon. Ding dong, Amazon brings it right to your door, okay? So the next time the kids come for their 15-minute visit, hey, can you put the shower chair together? I promise you the kids would rather put the shower chair together than have to come spend a week at the hospital and then spend 2 weeks at rehab, right? Or even better, I wish Drew and Kathy were here. Drew and Kathy Jolly own Next Day Access. It's a company that is specially licensed and insured in this state to go into the home, deliver the equipment, and set it up. I have a master's degree as an occupational therapist, but I'm not allowed to touch a shower chair that's in a box. They expect the durable medical equipment provider to come out and deliver that chair and set it up and know what height it's supposed to be for the patient based on their limited knowledge of the patient's diagnosis. This system is ass backwards. So we get paid by all insurances. We work with every single insurance. One of the best stories that I've ever had, I had a doctor send us a referral. He goes, she has everything, but I just want to make sure that she has everything, right? Measure twice, cut once type of deal. He goes, she has a shower chair, she has a grab bar, everything like that. We go into the house. She had a towel rod that consisted of a broomstick that was glued to tile that was 40 years old, and she had a Home Depot bucket turned upside down. That is not a shower chair and a grab bar, okay? After we sent the pictures of this bathroom to the doctor immediately called us the eyes inside of the home. Now, every single assessment that we do starts at the front door, ends at the bathroom. We hit every single room where ADLs occur. We make sure that they can get safely in and out of the home. We take pictures, we take measurements, put all of that in a report. It goes to the patient, it goes to the provider, it goes to the durable medical equipment provider if they want the information sent to them so that they know exactly what they need to do. Who knows what the going rate is to have grab bars installed in this area? One grab bar. So it's $269 plus an $85 trip charge. There's a guy who does them right there. There you go. If Drew and Kathy were here, they would tell you the same thing. And that's for a licensed, bonded, insured. I'm sorry, I don't, but this is what we're finding, okay? Now, many of the companies in the area that do this, that are licensed, bonded, and insured, actually work with our company because they know that we're going to go in and we're going to make an assessment of the space and we're going to make recommendations on equipment, okay? So we go in, measure. I went into a house yesterday. The gentleman is about that tall. The wife is about that tall. Their grab bars don't belong in the same place, right? So we found the difference, right? I looked at both of their abilities and we got the grab bars at about 33.5 inches. I put dots on the wall. I walk out of the house. I provide the report to the patient. I provide the report to the grab bar installer. The grab bar installer is going to go out and put the grab bars up where they belong. Everybody is covered from a liability standpoint and everybody's going to be happy. Everybody's going to be safer. So we are going to be working right now within PSA 4 with Amanda in the Department of Elder Affairs on a wonderful program that they have. So that's going to be from Nassau County all the way to the bottom of Flagler County and all the way out to Lake City for right now. It's just me and Jackie. If you haven't met Jackie, I explain her as me with more hair and she talks faster. All right? She's awesome. She's my right hand. She's another part of my left hand. She's the admin. She's everything to this company. So we are willing to go anywhere within PSA 4, especially with the FACE program that's going to be happening with the Department of Elder Affairs. There's another program that's going on called the GUIDE program That's for red, white, and blue Medicare. That's for Alzheimer's and dementia patients as well.